Hello, I am Nivedita Nageshmani from Shivaji Rao S. Jonle College of Pharmacy, Asangaon, studying in final year. In this video, I will give you a review on the effect of Berberis vulgaris and its major component Berberine on syndrome X, guided by Bhagyashree ma'am. Acknowledgements. Content: Introduction, Abstract, History, Marketed preparation, Method of preparation, Effect on high BP and stone, Conclusion, Results, Reference. Introduction. Scientific name: Berberis vulgaris. Family: Berberidaceae. Common name: Berberi. These are the Berberis. Chemical constituents. The main chemical constituent is berberine. The figure is given below. The structure is given in the figure, which is alkaloids and have several benefits. Next is palmitin, berberamine, vitamin C and iron for immunity and for curing the scurvy, citric acid and malic acid for astringent property. The alkaloids and basic organic compound containing at least one nitrogen group, which is useful in various diverse pharmacological activities like antimicrobial, antibiotic, antibacterial, antiviral, anti-inflammatory, analgesic, as well as anesthetic. Parts used are fruits, stem bark, leaves, root, extract. The leaves contain pecine, limonin or ocimene. The fruit contain benzaldehyde, benzyl alcohol, 1-hexanol and 2-hexenol. The stem barks are alkaloid rich, as well as the roots are rich in berberine sulfate. Berberine in metabolic syndrome, the properties: it act as anti-cancer property, it act as neuroprotective, and and it is used for the activity of antidepressant, for restoring the gut microbiota balance, for anti-inflammatory activity. It is used for the lipid profile improvement in insulin, anti-diabetic action. Composition of different parts of plant, like stem and root contains protoberberine alkaloids, bis-benzyl isoquinoline alkaloids, isoquinoline alkaloids. Fruit contain anthocyanins, vitamins, carotenoids. Flower contains polyphenolic flavonoids, acids, lipids, proteins. And leaves contains acids and phenolic compound. Uses: it is used for malarial fever and cough, liver disease, laxative and sedative, hyperlipidemia, hyperglycemia and bleeding, kidney stones and urinary tract infection. It also acts as protective of gastric mucosa, antimicrobial activity, improvement in the lipid profile by acting on the liver function. It decreases the liver enzyme, by which the improvement in the lipid profile is acted to the liver function. It also acts as anti-arrhythmic. Abstract: metabolic syndrome, or also known as syndrome X, a group of conditions that increases the risk of heart disease, stroke and diabetes, which leads to multiple organ failure, as nowadays most of the people are dying at very less age due to multiple organ failure. Cardiovascular diseases represent a significant health burden worldwide. In recent years, researchers have increasingly focused on herbal medicines as an alternative to synthetic drugs because of their potential side effect. Berberis vulgaris and its active component berberine, which is also known as BBR, have been extensively studied and have been shown to a various pharmacological activities such as anti-diabetic, anti-obesity, anti-hypertensive, hypolipemic properties. These properties make Berberis and Berberine potentially interesting for the management of metabolic syndrome and associated high cardiovascular risk reduction. This review suggests a role in the management of the metabolic syndrome. However, more studies specially reliable for the clinical trials and must be conducted to evaluate their effectiveness. Disease can be defined as health conditions that are clearly defined reason behind it. Disease and syndromes both are different, and syndrome is a Greek word which means run together. However, they may produce a number of symptoms without an identifiable cause. A syndrome refers to a group of symptoms, while a disease refers to an established condition. Disease disease can be cured by giving several drugs, but syndromes need a proper guidance as well as a proper acknowledgement. A syndrome is a group of signs and symptoms that are known to go together but do not have a clear cause, course, or treatment path. A disease is a disorder that affects your body function and also more likely to have known cause, a distinct course, and established treatment. History: over 500 plants from genus Berberis are accessible to people across the world, with 4 pharmaceutical organs being used for the treatment of different diseases. Means Berberis are used for various diseases. For more than 2,500 years, Berberis vulgaris have been essential components of herbal medicines. Russian therapists have relied on it to treat a variety of conditions including high blood pressure, inflammation, and irregular uterine bleeding. Various parts of plants such as root, fruit, and leaves have been utilized in traditional medicines for extended period of time. For example, the dried leaves and the stem bark are used to treat edema and hypertension respectively. In regarding to gastrointestinal system, the dried root is employed as an laxative, choleritic, and antidiarrheal, as well as possessing anti-rheumatoid, that is piles, anti-hepatitis, and anti-dysmonera properties. Meanwhile, the fruit is used for the treatment of the painful menstruations, hepatic dysfunctions, and whooping cough. Previous studies have shown that Berberis vulgaris contain numerous medicinal properties such as anti-hyperglycemic, antioxidant, hypolipidemic, anti-cancer, antipyretic, antihistaminic, antimicrobial, hypnotic, and activity that reduce the effect of jumping and locomotion, which is misbalance. Contained within the Berberis vulgaris are several isoquinoline alkaloids, among them being berberine as well as acanthin and bargestin. The organs like heart gets the effect of antirhythmic effect, heart failure, anti-inflammatory. Means Berberis act on this various effect. For gastrointestinal tract, it act as antidiarrheal action as well as laxative. Ovary, anti-dysmonera, and polycystic ovary syndrome, that is PCOS. On pancreas, the Berberis act as anti-diabetic. In brain, it acts as cerebral ischemia, Alzheimer's disease, antidepressant, and anxiolytic. adipose tissue or fat cells. It act as anti-obesity. Arteries, it acts as atherosclerosis. Liver, it acts as anti-hyperlipidemic, anti-hypertension, hypercholesteremia. In general, metabolic syndrome, which is METS, basically damages your kidney, insulin resistance, hyperglycemia, obesity, liver damage, hypertension, and leads to many problems. And the main cause of metabolic syndrome is taking multiple medicines without prescription or with prescription, but sometimes it affects your liver and can cause heart failure as well as kidney failure. So this all disease leads to cardiovascular disease like heart attacks as well as strokes or neurodegenerations. Marketed preparation: Berberis vulgaris for kidney stone, Berberis vulgaris for diabetes, and Berberis vulgaris for urinary infections. Method of preparation: in boiling water, add 10 to 20 drops of mother tincture, basically made up of the extraction of Berberis vulgaris. Drink 3 times a day in a cup of water. Take on empty stomach in the morning. As Ayurvedic medicine as well as the homeopathic preparations act on your body when it is empty. That's why it is suggested to taken in morning. You have to take it for 3 to 5 months to get a great benefit of it. Extraction methods: it is extracted by the Soxalate method, maceration, hot or cold solvent method. Effect on kidney and urinary tract stone. The mechanism of action of Berberis vulgaris on kidney stone is unclear and further research is needed. However, some of the recommended methods are: it prevents the calcium oxalate crystallization. What is calcium oxalate crystallization? Crystallization means the Berberis vulgaris and its active component berberine helps to prevent the crystallization of calcium oxalate, which is a common component of kidney stone. Calcium oxalate crystallization is a common component of kidney stones. Means it is a formulation of stones which appears in your kidney, and by preventing them the formation of these crystals, the herbs can reduce the risk of developing a stone. Removal of pre-existing stones. Now if it destroys or prevents the stone by acting on calcium oxalate crystals, so the next step is to remove the pre-existing stone. Some studies suggested that berberine may play a role in removal of small calcium oxalate stone, as it thought to work by breaking up the structure of the stone or attaching it to crystals, making it easier to dissolve and disappear in the urine. Vitamins benefit. Berberis vulgaris has an antioxidant property, means it reduces the oxidative stress and as well as inflammation. This factor affects the development and the growth of kidney stones by reducing oxidative stress, and the herb reduces the risk of the stone formation. Diuretic effect. Berberis vulgaris act as a mild diuretic and can increase your urine production. So increasing the urine production can help to flush out small stones or crystals that forms, preventing them from growing into larger stones. It is important to note that the mechanism of action of herbal remedies such as Berberis vulgaris are complex and may involve multiple pathways. Although these proposed methods are promising, more scientific studies are needed to confirm the ability of Berberis to prevent and treat the kidney stones. If you have kidney stones or at a risk of developing them, it is important to consult a healthcare provider or a healthcare profession for advice on the proper treatment and management of the dosage interval and the dosage frequency of yours. Effect of high blood pressure. The Berberis vulgaris contains an active compound called berberine, which have been studied for its potential effect on various health problems including hypertension. Berberine found in berberry and some other plants have studied for its potential antihypertensive or blood pressure lowering effect. Mechanism by which berberine may help to lower the blood pressure is vasodilation, endothelial function, anti-inflammatory, antioxidant, reduced sodium retention. In this figure, you will see vasodilation means the normal blood vessels when get dilated, or the blood vessels when get dilated, which is vasodilation. It increases the transport of oxygen, nutrient and glucose in your blood, and it decreases the blood pressure and removes the cellular waste product. Berberine can help to relax your blood vessels, which is vasodilation. It can lead to drop in blood pressure. Endothelial function means the inner layer of the blood vessels improve the function of endothelium, which is the inner lining of the blood vessels, which play an important role in regulating the blood pressure. Anti-inflammatory. Berberine has anti-inflammatory properties and chronic inflammation, which can contribute to a high blood pressure. Antioxidant activity. Berberine is an antioxidant and oxidative stress which is related to blood pressure. By reducing the oxidative stress, berberine can help lower the blood pressure. Reduce sodium retention. Some studies suggested that berberine has helped to reduce the reabsorption of the sodium in the kidney, which can lead to decrease your blood pressure. Causes. Main causes is genetic factor or environmental factor, and an environmental factor which includes inappropriate diet, lack of physical activity, smoking, stress, toxins or drugs overtaking. Effect. Dyslipidemia, hypertension, elevated blood glucose, obesity, insulin resistance, oxidative stress, pro-inflammatory state, gut microbiota alteration. Metabolic syndrome. Metabolic syndrome leads to the disease like cancer, PCOS, polycystic ovary syndrome, type 2 diabetes mellitus, atherosclerosis, non-alcoholic steatohepatitis. Implications. Leads to cardiovascular diseases like heart attack, stroke, neurological and neurodegenerative disorder. Conclusion. Speaking on Berberis vulgaris, the review confirmed that it works and cures people from suffering the people who suffers from urinary tract infection, kidney stone, diabetes mellitus and high blood pressure, etc. The most useful homeopathic preparation recommended by the doctor is mother tincture preparation of tablet for stones and urinary tract infection. It also affects the insulin resistance factor and improve the diabetes level of patient. It is a slow and steady process, but if you manage your diet and lifestyle, it can improve your overall health and can cure your disease. Widespread use of herbal medicines as in complementary medicines is gaining popularity worldwide. Many drugs are derived directly from the plants while others are natural products and they have been chemically modified. As nowadays most of the people are depending on the allopathy medicines which which just give you a temporary action by decreasing or by depressing your CNS, which is central nervous system, and by acting as painkiller or pain reliever for some times. But the homeopathic can cure your disease and can give you a lifelong action by curing your disease from its root. Original scientific paper published so far have confirmed that the pharmacological potential of Berberis vulgaris and its component berberine. This agent has shown significant anti-diabetic, hypolipidemic, anti-hypertension, anti-obesity effect in vitro and to a lesser extent in clinical trials. But the clinical trials in Berberis vulgaris is much more needed as of now by getting to know to its variety of the properties which are used for the pharmacological actions. Based on the present review, it can be concluded that Berberis is a promising tool for the treatment of various aspects of metabolic syndromes. However, further clinical studies are needed to demonstrate the therapeutic efficacy of Berberis vulgaris and Berberine. Result: to obtain the result on a review article on the effect of Berberis vulgaris, which is Berberi or Sar Berberi, on metabolic syndrome reveals several important findings and implications. Potential therapeutic benefit: it has associated with the improvement in the blood glucose regulation, insulin sensitivity, lipid profiles, and blood pressure control. Antioxidant and anti-inflammatory effect: berberine found in the berberis act as antioxidant and anti-inflammatory property that are important for reducing the chronic low-grade inflammation often associated with the metabolic syndrome. The vein get inflamed and get several pain, so berberis act on it and reduce it. And either when the people who are suffering from stones get several pain and berberine act on it and reduces the pain. Dyslipidemia is the imbalance of the lipids such as cholesterol or low density lipoprotein cholesterol, which is LDLC, triglycerides, and high density lipoprotein, which is HDL. This condition can result from diet, tobacco exposure, or genetic and can lead to cardiovascular diseases with several complications. Weight management: some studies suggested that berberine may contribute to weight loss or prevention of excessive weight gain, which can significant factor in metabolic syndrome. The buildup of fat, cholesterol, and other substance in the artery and on the artery walls. The buildup of the cholesterol plaque on the wall of the arteries causing the obstruction of the blood flow, and the plaque may rupture by causing an acute collision of artery by clot, which can lead to strokes as well as heart attack. Modulation of gut microbiota: berberine has potential to positive influence the gut microbiota, which play a role in metabolic health. Complementary therapy: as a part of an integrated approach, Berberis vulgaris can complement conventional treatment for metabolic syndrome, potentially reducing the need for multiple medications and associated side effects. Safety and tolerance: Berberis vulgaris is generally well tolerated but individual reaction may vary, and hence clinical supervision is recommended, especially if used with the other drugs. Although these findings are promising, but further research is needed to confirm the effectiveness of Berberis vulgaris in the treatment of metabolic syndrome and to determine the most appropriate dosage and treatment. People with metabolic syndrome should consult their healthcare professions before using the herbal products such as Berberis in their treatment plan for better action. Allopathy affects the specific affected organ or the part of the body, but there is always the risk of side effect and infection spreading to adjacent part of the body. Homeopathy is generally risk-free because it does not affect other part of the body and aims to heal the whole body by curing the disease, not just the affected part. Medicines can harm the liver by directly damaging the liver cells, which is hepatocellular, or by blocking the flow of the bile in the liver, which is cholestatic, or by doing both. This is why the healthcare providers and the doctors recommend the homeopathy remedies the most. While these findings are promising, but the further research is needed to confirm its effectiveness of the Berberis in addressing the metabolic syndrome and to identify the most appropriate dosage form and the treatment protocols. Reference. Thank you.